Welcome to the Nurse Navigator Network. Today we're going to review NCLEX questions and answers with rationales on the topic of abuse and neglect. Let's jump right in. Question 1. Nurse suspects that a child brought into the emergency department is experiencing physical abuse. The child has multiple bruises in different stages of healing, and the parent gives vague explanations. What is the nurse's priority action? A. Document the findings and discharge the patient. B. Confront the parent about possible abuse. C. Report the suspected abuse to Child Protective Services. D. Wait to see if the child discloses abuse. Answer C. Report the suspected abuse to Child Protective Services. Rationale: nurses are legally mandated reporters. When there is suspicion of abuse, the priority is to ensure the child's safety by reporting to appropriate authorities. Documentation is important, but mandatory reporting takes priority. Question 2. An older adult in a long-term care facility appears malnourished and has pressure injuries. The nurse overhears a staff member speaking harshly to the patient. Which action should the nurse take first? A. Report the incident to the nursing supervisor. B. Encourage the patient to eat more. C. Ask the staff member to explain their behavior. D. Document the pressure injuries and continue monitoring. Answer A. Report the incident to the nursing supervisor. Rationale: suspected elder abuse or neglect must be reported immediately to protect the patient. Direct action ensures safety, and then further documentation and investigation can follow. Question 3. A nurse is assessing a teenager who arrives at the clinic with frequent injuries. The parent answers all questions quickly and does not allow the teen to speak. Which nursing action is most appropriate? A. Ask the parent to step out so the nurse can interview the teen privately. B. Document that the parent is overprotective. C. Provide written information about abuse hotlines and discharge the teen. D. Accept the parent's answers and proceed with the visit. Answer A. Ask the parent to step out so the nurse can interview the teen privately. Rationale: adolescents should be interviewed alone to allow disclosure without fear or intimidation. This helps the nurse assess for possible abuse or neglect and gather accurate information. Question 4. A patient with a disability arrives for a routine appointment. The nurse notices the caregiver answering every question, preventing the patient from speaking, and the patient appears withdrawn. What should the nurse do? A. Ignore the situation since the caregiver is helpful. B. Assess the patient privately for possible abuse or neglect. C. Ask the caregiver to provide more details about the patient's history. D. Document that the patient is withdrawn and continue with the visit. Answer B. Assess the patient privately for possible abuse or neglect. Rationale: adults with disabilities are vulnerable to abuse and neglect. A private assessment gives the patient the opportunity to speak freely, which is essential for safety and proper care. Question 5. During a home health visit, the nurse notices that a child is often left alone for long periods, appears dirty, and reports not having food at home. What type of abuse is most likely occurring? A. Physical abuse. B. Emotional abuse. C. Neglect. D. Sexual abuse. Answer C. Neglect. Rationale: neglect occurs when a caregiver fails to provide basic needs such as food, shelter, clothing, and supervision. The signs described are consistent with neglect rather than physical, emotional, or sexual abuse. Thanks for tuning in. Like, subscribe, and hit the notification bell to receive our next NCLEX review as soon as it is released. Drop a comment and let me know if you need to review any specific areas of nursing. See you again soon.